Can you guys hear me?
Loud and clear.
Perfect. Well, after watching this video from Sierra Leone and Somalia, I make the funny observation. This is a very typical, very typical delivery room in rural areas of Africa. Most African countries is like this. It's not specific to these two countries. My second observation is this. There is one labor room, one delivery bed. For all you know, there might be more than 10 deliveries in that facility in one day. And 10 women coming from different backgrounds with their different illness and diseases to have a delivery in one delivery bed. During delivery, we know that there's what we call amniotic fluid, the fluid around the baby. It spreads and flashes everywhere. It makes a mess in the whole place. We also know that the baby comes out by pushing. We say push, 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 push. Push for me means poop, 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 poop. Poop means people just have to defecate. I do this at least 1 or twice a week. 90% of women will defecate before baby comes out. It now makes sense to me why when I was growing up, I remember we were telling women that if you want to come to labor, do some enema. That is just to empty the bowels before they come. We don't do that in this part of the world because we have water to clean things. So imagine fecal matter everywhere in the delivery room in one bed where everybody delivers. When you compare that to this part of the world, whereby in my hospital where I deliver babies, there are at least 10 beds for delivery women. I mean, there are about 15, 20, there are 20 please, there are 20 in one floor. So each of these delivery room has their own bed, their own newborn facility and everything. A woman comes there. If the woman is in labor for 5 days, it stays there for 5 days until baby is delivered. When baby is delivered, it stays there for another 24 hours observation before going home. If something happens, she needs to stay longer, then she goes to the postpartum floor. Postpartum floor means where you go after delivery of the baby for baby to be taken care of, make sure mom is fine before they go home. So put that in context whereby one delivery bed, no water, fecal matter, amniotic fluid, and other skin diseases like scabies, birth ulcer, MRSA will come. That's a super bacteria, staph infection, causing infection from different women in the community. So without adequate water, this bed cannot be cleaned thoroughly for the next mother. We know that. Number two, our women don't come to the hospital until they are about delivery. So imagine a woman coming about to push out the baby and ask the family to go get water from the stream. That's a no-no. So with water, without water, you can guarantee spread of infection. There's what we call intrapartum infection during delivery. It's a must. What we call postpartum infection after delivery. Also what we call perinatal infection of the baby after delivery. These are, so intrapartum, postpartum, that's to mom. Perinatal or perinatal mobility or mortality is infection affecting the baby or the newborn after delivery. This is very common. We also know that what we call nosocomial infection, nosocomia, which means hospital acquired or hospital spread infection. So the patients don't only bring their own disease to the hospital or to the birth center, they also carry some diseases from the birth center and go back home. So infection from patients and population is spreading to the hospital. The hospital or the maternity center is spreading hospital-related infection to the community. And we know that infection from the hospital is usually caused by super bacteria that has multiple resistance, which means common antibiotics cannot take care of hospital-acquired infection. We need stronger antibiotics. So Please put all this in context. You know that potable water in a birth center is a must. It's not a luxury. It's a human right, both for the mom and for the baby. So just to explain why the under 5 years mortality, that means children who die before their 5th birthday in Africa will never improve until we have adequate water in the community and the hospital. So based on this, I cannot emphasize the need to provide adequate water in bathing centers for women and children. And therefore, this particular program, Operation Borehole 55, is to provide borehole in as many African countries as possible, in as many rural communities as possible. I must say, we are just going to try our best. We cannot solve all this problem without government intervention, but providing one borehole in one birth center in one local community will save thousands of children's lives in the next 10 years. Will save thousands of women's lives in the next 10 years. And more importantly, will provide an amazing birth experience with one goal in mind: happy mother, happy baby. In this part of the world, if a woman dies from childbirth, I don't care, is it in America, is it in London, is it in Ireland? If a woman dies of childbirth in the state of Washington, where I live, the Senate of the House will hear about it. The Senate will sit down and say, what happened in Spokane, Washington last week that a woman died of childbirth? What happened? Was it the doctor's problem? Was it the woman's problem? Was it a systemic problem? And find out what is the best way to solve this problem. And the reason why they do this is because they want to make sure it doesn't happen again. I have been practicing in this country in this particular hospital for more than 11 years. No woman, absolutely no woman have died of childbirth. I did practice in the United Kingdom or Ireland for 5 good years. I actually did more delivery in that country because I was doing pure OBGYN. For my 5 years there in the hospital, we deliver at least 2,000 births every year. That means about 10,000 deliveries in that hospital. Only one death, only one, and that woman who died was discussed in the Senate of the country, because Ireland is a smaller country. The Senate discussed and found out what happened, and they made a recommendation and found out what really went wrong, and then that was taken care of. Before I traveled to the UK to start practicing medicine, I was practicing a center in a city called Owerri. It's a referral center. I will guarantee you, every week, at least 2 babies will die in the mother's womb. 2 babies. And then every month, let me say, about 2 or 3 times a year, we're gonna lose mother in the hospital. Not to talk of those who die in others. This is a referral center whereby we'll do everything by standard to avoid death of children and mother. Most of the children that die in this center actually die en route to the hospital. They have been in a rural maternity center, trying to deliver their baby, and then the baby die in their womb. They come to us for help. Most of the women who die in the hospital has already got infected in the rural community centers or health centers. They transfer them to our center where they are very, very sick. We couldn't save their life. And I would always like to share this story whereby one day I had this woman prepared for C-section, about to deliver her. That was her 7th baby. The baby was just what they call unstable lie. The head first, leg first, arm first, just thrown around the tummy. The mom agreed for cesarean section. 30 minutes to the surgery, her husband came from work and said, give me my wife, and took his wife away. Went to the nearby maternity center manned by untrained nurses. She delivered a baby. The man came to the hospital. You see, you doctors want to collect my money. My wife have delivered safely. At that point in time, another woman wanted to give birth by cesarean section, pack her stuff, and went to the maternity center. That same day, that woman died. The first woman died of postpartum hemorrhage. She bled to death. The husband did not come back to tell us, oh, my wife died. She didn't come back. They said, well, it's God. So what am I saying? People are dying every day from water-borne diseases. Women and children are dying from what preventable disease caused by lack of water. By this, I mean disease from home, disease from the hospital, and innocent, very innocent, because every newborn kid is cute. Cute, innocent newborn baby, supposed to come out and smile, within 1 week get sick and die within a month or two. This is not good for the baby, not good for the mom, not good for the community. So with this, I would say, let's come together, support this project, and I will start my own donation today with a sum of $1,000.